Thank you. As Bastian said, my name is Tobias Bøggild-Damkvist, and initially I must say I'm humbled by the work you do in India, and the numbers are absolutely mind-blowing. 70 million people, and then we can talk about the Danish diabetes community. That's 30,000 people with type 1 that we are trying to improve treatment of. But it's humbling to see here those numbers. Well, type 1, together with a small group of healthcare professionals and people with diabetes, I run this Danish patient advocacy organization called Type 1 Think Tank for Diabetes. We get our inspiration and knowledge internationally, but we do all our work very, very local level, just working with the Danish diabetes community within 3 areas. First of all, we try to support user-driven innovation and user-led treatment. Second, we strive to improve access to technology, working with public agencies, politicians, suppliers, and reimbursement, as well as doing peer-to-peer work, especially in the DIU field. And finally, we try to improve sustainability in healthcare, working amongst others with Novo Nordisk on designs and initiatives within their Circular to Zero program. But the project I want to talk to you about today is one of our long-term initiatives. We've been doing this for a year now. That's educating young doctors in communication. In Denmark, when you graduate from a university with a degree in medicine and start working at a hospital, there is this mandatory 2-day communications course that you have to take within the first 2 years of work. It's not much, but much better than nothing. And through our work within the Danish Society for Patient Safety, we have weaseled our way onto the curriculum of this communication course. So every other month, the think tanks participate in educating 30 young doctors in communication alongside a psychologist and a doctor. And what we try is that through cases and personal experience, we will convey some core messages. And I must admit, we've been very inspired by the Langio Matters movement and the research in England. But what we try to convey to those young healthcare professionals is the following messages: that we are not our disease, we live with it. Your job is our life, and none of us chose to be patients. So we try to get them to remember and keep the perspective that for people with chronic condition, 99.9% of the treatment takes place outside the hospital. And that for communication, the core message to them is listen. And if in doubt, keep on listening, and then talk in a positive and encouraging manner. So we know it's a long-term investment, but we hope to push the medical culture toward a more open and accommodating view of patients.
Thank you, Tobias. I think that's a very important message, and especially your work of reaching out to young doctors, the next generation of doctors. I think that also resonates very, very well with what ISPAD is about, training them to become closer to the patient voice, closer to us and working with us and not just for us. Sorry for cutting you off here, but I'm trying to stick to time. So